So what is an ankle fracture? Basically, when someone has a forceful injury to the ankle, may it be due to a bad landing or forcefully twisting the foot with some rotational force, one can succumb to an ankle fracture. So basically, if we were to look at this model of an ankle here, you can see that there is an outer part which is supported by the fibular bone and the inner part which is supported by the tibia bone, and of course lying in between is the talus, and this is basically what an ankle joint is comprising of. Now you can typically get a fracture of the distal end of the fibula, and you can also get a fracture involving the inner part of the tibia, which is called the medial malleolus. Now if there is a fracture, typically the entire ankle will be very swollen, it will be very tender, and you won't be able to put weight on the foot involved. Therefore, when you get an X-ray, it will clearly delineate the extent of the injury, whether it's just involving the fibula or if it's involving the fibula as well as the medial malleolus. Based on the displacement of the fracture, the doctor will then advise you on two options. Either you treat it conservatively if it's undisplaced, or you may be advised for a surgical fixation if it is displaced. Conservative treatment typically involves casting or an ankle boot to immobilize the ankle until the fracture heals. Surgical option would mean an open reduction and internal fixation, with the goals being to restore the anatomy, to realign the bones in the correct alignment, and this will typically involve inserting screws and plates. This will also give stability to the fracture and it will allow early mobilization. Now it is important to ensure that the ankle biomechanics is maintained, because if there is a significant displacement, then it can affect ankle movement and the joint mechanics, which can lead on to osteoarthritis. Therefore, whenever you have a bad ankle injury with a suspicion of a fracture, get early diagnosis, get an X-ray done if in doubt, and it's important to study the fracture pattern critically, and you'll be advised on the best management option to restore function and mobility. Thank you.